Hello, everyone. Happy Thursday and welcome to the continuation of our webinar series for our stay home quarantine education from Cosmetic Laser Dermatology. Today, I'm very excited for us to be here with Dr. Monica Boen. She's a board certified dermatologist. She has expertise in many areas of medical and cosmetic dermatology, including injectables, lasers, body sculpting, and of course, medical dermatology as well. She even sees some patients for insurance on the West Dermatology, our sister practice, so that's a good hint. I'm just gonna give a couple more seconds for everyone to start joining and to get onto this webinar. In the meantime, I realize I have this fun virtual background up. I can take that off to be the same. Anyways, thank you again for joining us. I'm gonna run a little poll right now while we're waiting for everyone else to join so we can learn a little bit more from each of you what you're hoping to learn today. So here's the poll that should be up on your screen. Please help answer these questions so we can best present to you guys today. All right, I see a lot of you voting. Give another 30 seconds here. We appreciate your feedback. All right, 15 more seconds. All right, everyone press submit, please, if you can. All right, well, thank you for those of you that posted. So let me share these results so Dr. Boen can see. So it seems that most of us are using eye creams, some all the time and some always. Most people are bothered by their droopy eyelids or brows, so that's great. Dr. Bowen's definitely going to speak to that today. And what have you tried before? Let's see, about half of you have tried Botox, and no one's really tried any fillers, and very few lasers and skincare. So thank you for that feedback. And now I want to officially make the final welcome. I think everyone's gotten here now. Thank you all for joining us on this beautiful Thursday afternoon, well, in San Diego for us and wherever you might be. I am pleased to share Dr. Boen with you next. She's a board certified dermatologist with us at Cosmetic Laser Dermatology. She has vast experience. She's phenomenal at all types of procedures. And today she's going to be focusing on eye rejuvenation. So how to rejuvenate all the areas above, on the sides, and below our eyes that I know a lot of us have an interest in. Some of you guys specifically requested this, so I hope you appreciate it. And with that, I will hand this over to Dr. Monica Boen.
Hi, and welcome, and thank you for joining our webinar series at Cosmetic Laser Dermatology. So let's get started on eye rejuvenation. Okay. So today's discussion topics. First, we'll talk about some of the causes of aging around the eyes, a little bit of the science behind that. We'll talk about preventive strategies, and I'm happy that a lot of people are using the eye creams. It's a great way to keep the under eye moisturized and prevent the wrinkles from forming. And then we'll talk about 3 main treatment options. There's multiple treatment options, but just for the sake of time, we'll focus just on a few to keep it simple. We'll talk about neuromodulators, which are your Botox, Dysport, Xeomin, and Jeuveau, the 4 ones currently on the market, and we have all of them at our office and are familiar with how to inject all of them. We'll talk about fillers, especially under the eye. It's become very popular. And then we'll talk about laser treatments to rejuvenate the eye. And so I think a lot of people are interested about the eye rejuvenation topic because the eyes are one of the first things that strike you about a person. And studies have shown that most people look at other people's eyes. Even when they track kind of people's movements, the first thing they look is towards the eyes. And so that's why it's an important area for a lot of people, and patients have a lot of concerns about this area. So in a youthful face, there's a smooth transition between the cheek and the lower eyelid area, and there should not be a separation there. However, as we age, and as shown here by Brad Pitt and Meryl Streep, you start to lose that lid cheek junction. You start to have more loose skin. The skin texture changes. There's a few more blemishes there. And this is all due to underlying decrease in bone resorption, loosening of some of the ligaments and muscles of the eye. And so we'll go a little bit more into the anatomy around the eye. So the eye is, of course, supported by the orbital bone. We have some ligaments, and then there are several fat pads around the eyes. And with age, these fat pads can reposition. So sometimes puffy eyes under the eye is repositioning of an infraorbital fat pad. And also we lose some of the fat around our eyes as well, and this leads to a hollowed eye appearance. Furthermore, we have this muscle here around the eye, orbicularis oculi. That is what causes a lot of the crow's feet that is disturbing to a lot of people. And so we'll talk about treatment options for that as well. And then on the right of your screen, we have different grades. So in our clinical studies, which we have a big research center at our clinic as well, we have a grading system of how deep some of this is specifically the tear trough area, how hollowed it is. And so we use a scale from 0 to 5 to grade how severe it is, and then we can give you more options on how to correct it. So prevention, of course, is key when you're trying to protect the eye area. So number one, of course, is diet. So you might notice after you eat a salty meal or a very salty fast food meal, you'll notice the next day puffiness around the eyes. And so this is just due to increased salt intake and more edema or swelling around the eye. So keeping a good healthy diet is key in overall skin health, especially around the eyes. Secondly, sleep hygiene is really important. So you want to get adequate sleep. And so a lot of people know too, like if you're having a stressful week and you're not getting enough sleep, your eyes will look more hollowed. Your coworkers or friends will ask you why you look so tired. And so this is something that's really important to take care of as well. Third of all, sun protection. So this area under the eye gets a lot of sun. So using sunglasses whenever you're outside, with the UV protection, and then sunscreen under the eyes and hats are a great way to protect this very thin skin around the eye. And then something that people I think sometimes forget about too is there's medical conditions that can cause increased pigment around the eye. So suppose you have eczema or allergies, you might be constantly rubbing the under eye area. And this will cause increased skin laxity and pigmentation, sometimes more blood vessels. So it's important to address that issue as well. And of course, minimize as much as you can eye rubbing. Even sometimes, unfortunately, putting in contacts and stretching the skin every day can have an impact on lower lid skin laxity. And then lastly, it's good to use topical antioxidants and growth factors as well as a good moisturizer under the eye to help with improve the skin texture. And on the right here is just one of our clinical studies that we published. We used a novel skin cell extract cream. It's called Calicin. It was a split face study, so it was used all over the face. You can notice that the eye the under eye area is a little smoother. It's less rough and a little less inflammation or that redness around the eyes. So just using topical treatments can help. Of course, it's not a miracle, but it's definitely something that we encourage to use along with other procedures around the eyes. And so there are multiple eye creams available on the market. There are clinical grade ones, and these are usually sold in medical offices. And these are my top 3 that I recommend that are available in our office. One is the TNS Night Eye Repair Cream. The TNS Night Eye Repair has really good growth factors that help stimulate collagen and keep that youthful appearance under the eyes. And it's a very pleasing texture too, so I really like applying it. The next one I like to use is the SkinCeuticals AGE Eye Complex. These are more like antioxidants and really good moisturizers. I like to use this one in the morning. It actually, it moisturizes very well and it kind of creates like a nice glow under my eyes. So I appreciate that. The next one is the Color Science Total Eye. This one has SPF and a tint. So this one you can actually use as a concealer. It has SPF, has good moisturizing, and some good plant botanicals. So it kind of gives you pretty much an all-in-one treatment if you're going out. This is great to keep in the purse. Of course, we have budget options. So one of my favorite brands is CeraVe. They have a really good eye repair cream, mainly for moisturizing. If you need a retinol, the Rock Retinol Eye Cream is a good budget buy, very affordable. Patients like that one. And then lastly, the Olay Regenerist eyewear has B vitamins, I think vitamin E and a good moisturizer to help with the under eye area as well. And the clinically products are available at our store at Cosmetic Laser Dermatology, and we are able to ship those out to you as well. So let's talk about a little bit the targets now for eye rejuvenation. So in this photo, we have an example of the aging eye. They're developing a tear trough. You can see there's more bulges in the lower eyelid. This is due to displacement of fat. You're starting to see these grooves and shadows. And the upper eyelid skin, as you can see, is the texture is a little wrinkly and it's starting to droop and almost kind of taking over the eyelid area. And so the main things we address are volume loss in the area. Next, blood vessels. So here are the volume loss areas. And a lot of times we have more visible blood vessels when the skin starts to thin out. Next is pigment here. A lot of times pigment is actually genetic. So in darker skin types, pigment under the eye can be genetic, and it can be due to either hemosiderin deposition or decreased volume in there that creates shadows under the eye. And then lastly, skin texture can create, improving the skin texture can create a more rejuvenated eye appearance. So the next photos will show you. It's hard to just address one thing when you're treating the eye. So usually I'm trying to address more than one thing. And in this patient, we'll address volume loss and blood vessels. So this patient had probably more genetic hollowing in the lower eyelids and a little mild wrinkling here in the crow's feet starting to develop. And you can see here because there's more hollowing and perhaps loss of the fat there, you can see more blood vessels. And this is why it looks darker. For her case, it was more that the blood vessels were more visible. And so for this patient, I did filler under the eyelid, and that added volume to mask the blood vessels. And then just a little bit of neuromodulator to the crow's feet to help smoothen the area. This patient's a little older, also had a lot of hollowing. It even looks like she has dark circles under the eyes. And this was also due mainly to thinning of the fat pad under the eyes. And that's how you can see more of the blood vessel that's causing the darkening. And then she was having some mild wrinkling around the eyes as well. And here, treating the crow's feet, we also did the forehead, the whole upper face with a neuromodulator, and then adding, this patient needed probably this was more 2 filler sessions in order to fully correct this tear trough area and rejuvenate the eye. And this is a video, so usually I do needle and cannula when injecting filler. For the under eye, I'm usually using a cannula. It's a very delicate area. It's a lot of blood vessels. And so this will just create less bruising and less swelling after the procedure. Here's just one insertion, and this is nothing sharp at the tip of this. It's a little cannula. And I just insert a little bit throughout. So it's a very comfortable procedure. And you can see immediate volumization afterwards, or maybe a little bit of swelling after, maybe a bruise at where that little injection site was. But otherwise, this is an in-office procedure, and you're able to go back to work the next day. Sometimes you may just have a little bit of swelling and one little bruise that we will complimentary to take away with the laser the next day if you'd like. And I want to include this study because what are the long-term effects of using Botox to lift the brow and around the eyes? So a lot of celebrities now are using Botox to increase to elevate the brows. And if you use this long-term, this patient actually used it for 19 years, you will actually maintain brow elevation. As you can see here in this photo, this was before and after in this study, and her brow position is actually a millimeter to 1.5 millimeters higher than she began with. So using these neuromodulators long-term can prevent or delay eyebrow drooping, which is pretty remarkable. Then you can avoid a surgery in the future, but it's good to know. And from other studies using neuromodulators, we know that there are long-term cumulative preventive effects that these neuromodulators can provide for patients. And now we'll address volume loss, pigment, and skin texture. So this patient had some pigmentation around the eye and mild skin wrinkling around the eye, especially the lower eyelids, and then a significant amount of volume loss. And so in patients with darker skin, you have to be selective the laser you use, because you can cause hyperpigmentation and other post-inflammatory hyperpigmentation changes. So for this one, I did microneedling radiofrequency, which is you usually do topical numbing, and these are these very tiny needles with heat delivered at the tips using this specialized energy-based device. And you do this treatment a few times. I say the downtime is 3 to 5 days, and it takes usually at least 2 to 3 treatments, and it'll strengthen the skin and also build a little bit of collagen and decrease the amount of wrinkling around the eyes. And also then I used a filler with a cannula to help revolumize the area as well. These were the targets, and a lot of times there was a little bit of pigment here, but a lot of times it's shadows that's creating these dark circles that patients don't like. So filling those shadows with a filler, strengthening the skin with a laser are 2 ways to help address these dark circles. And then probably one of my favorite procedures, we're talking about one of my favorite procedures for patients with a little bit more skin laxity around the eyes and perhaps a little bit older. This will address volume loss, pigment, and skin texture. So this is laser resurfacing. This will probably give you the best results for improvement of skin laxity. As you can see here, I'll put a little pointer. We're starting to get a lot of skin laxity and drooping of the upper eyelid, and you're able to correct this non-surgically with a CO2 laser. It has a little bit more downtime than the radiofrequency microneedling laser I just talked about. However, you get these amazing results, and it erases all of these lines here around, and no filler was used for this patient, just CO2 resurfacing. And even a year later, this is a result that gets preserved for 5 to 10 years. It improves skin texture. Since it strengthens the dermis, you're hiding those vessels that are in the periorbital area. And it's a much brighter appearance with this. It can also get rid of some of this darkening around the eye, which may be due to sun damage, maybe like irritation from allergies. You get hemosiderin deposition. And so it helps erase a lot of this pigmentation, strengthens the skin texture is better, so the skin looks glower, it's more shining, and of course too, you're getting rid of this excess skin without a scalpel. It's just using a laser, so there was no cutting for this. So it's much more youthful appearance, especially in the upper eyelid. And you can tell that from the side too. It's just the eyes are much brighter. This fine wrinkling is gone, and we did not have to do any cutting or blepharoplasty for this patient to improve her upper eyelid. So in summary, multiple treatments are available for eye rejuvenation, and we have multiple lasers that we could try. And for the sake of time, I kind of focus on a few of them. And then I try to tailor each treatment for specific patient concerns. And we have over 50 lasers are practiced that we can tailor downtime and exactly what do we want to address: volume loss, pigment, blood vessels, or skin texture. And I miss all of my colleagues at work. This is us at a conference presenting our research, but also having fun. I miss my MAs. We try to do something together every quarter. We went to Soul Cycle last time. And then this is my husband here. He doesn't like to be on social media, but he approved this photo.
Thank you so much, Dr. Boen. That was amazing. Very informative. So some people have already been submitting questions, but for those of you who are waiting, on the bottom of the screen here should be a little box that says Q&A. So this is the time for you to start to putting in any questions that you may have for Dr. Boen about anything she spoke about, or just about any kind of eye rejuvenation in general. So let's get started. I've heard thread lifts don't last very long. Is there a similar procedure or treatment that's more long-term that might help with my droopy eyelids?
Probably it's true. Yeah, the thread lifts can be more temporary, and then gravity kind of will help as well. Will kind of negate that effect. So probably the CO2 laser would be more of like a long-lasting effect to help rejuvenate the area. And there's other ones too, like Fraxel, or for example, I didn't talk about this, but Maj too is a radio frequency device. Also a few before and after photos, which can also has lower downtime, can help smoothen the wrinkles around the eyes and then elevate the brow.
Okay, great. All right. Here is one. Cynthia says, where was the laser used in the laser treatment? On the upper eye or above the eyebrow?
Oh, for those patients, we actually treated the entire face, but when I do treat the eye area, it's basically just below the eyebrow to help get rid of that excess skin laxity for just doing around the eyes. And then we go all the way to the lower eyelid. So you have metal eye shields in for safety, but we basically the entire upper eyelid and entire lower eyelid.
Great. All right. This is from David. I am a current customer here. I have a question on eye floaters. Anything to treat eye floaters? Mine is bothering me.
Yeah, so I actually asked my my ophthalmologist friends about this. There is some that they kind of handle it. You actually need a specialist who does this in ophtho. This actually bothers my mom so much too. There's a surgery that can help with the floaters, but it is risky, so it's plus or minus, and they don't offer it to all the patients.
Oh, someone in here is saying, I am an ocular plastic surgeon. Maybe he could comment in on that.
Can you comment?
Yeah, let's see. We haven't done this before, but Sereni, I wonder if, okay, well, I don't know how to make.
Oh, hi, yeah, and of course, yeah, oculoplastics, if it's something that we work with them a lot too, because if sometimes you need a surgery, if it's more extensive skin laxity or the fat pads have shifted, I will then, of course, I'll be honest with the patients and say that they might need surgery by oculoplastics.
Yeah, and so Srini said, I do not know how to pronounce your name at all. I'm sorry, but he says, yeah, floaters are best treated by a general ophthalmologist, like Dr. Boen said. So thank you. Okay, let's see. Another one from David. So he says, laser resurfacing, does it need to be repeated every few months like Botox?
Laser resurfacing, when we do the deep CO2 and erbium ablative laser resurfacing, that probably doesn't have to be repeated for 5 to 10 years. And we follow these patients long-term and done studies, and they are maintaining these results for years afterwards. So I plan to, that's going to be on my hit list for sure when I start to notice a little bit more laxity. I'm going to get the CO2 right away.
All right. Solange says, would you be able to give us an idea on the price for these laser resurfacing treatments?
Sure. We do it by area. So a lot of times around the mouth is very popular because that's when we start to notice the wrinkles first because of the dynamic movement with the muscles. And so if we're just doing the eye area, it can range from, usually starts at 2,000, the entire face goes up from there. The other ones like microneedling around the eye can start from like 500 to 1,000 per treatment, but you need more treatments, but it is less downtime.
Okay, great. Okay, here's a new one. So how can I ensure that I will not look frozen if I get things like Botox and fillers all around my eye area?
Yeah, no, I think it's really important to keep it natural, and usually we can start with a lower dose. So a lot of times patients want the crow's feet completely gone, but that's when you get the frozen look. It's a trade-off between having no wrinkles, but maybe looking a little frozen. So a lot of times we'll do a lower dose of the Botox, and we can always add from that in 2 weeks just to make sure it's natural. You can still have some expression. And then for under eye fillers, I will do no more than 1 syringe per sitting, sometimes even less, because in the under eye, actually less is more in that area.
Okay, great. Here's one from Nancy. Which of these treatments would be safe to do during pregnancy or breastfeeding?
I probably wouldn't do no Botox or the fillers during pregnancy. I probably wouldn't do the microneedling during pregnancy just because of the possible electricity. You can probably do like a lighter laser, like a Fraxel laser around the eye during pregnancy, because that will just be heat locally. But probably the fillers and the other ones, and of course, do not use the retinols during pregnancy. You can use like antioxidant eye creams or moisturizer eye creams, but no retinoids or retinols during pregnancy or breastfeeding.
Okay. Virginia says, is the downtime due to peeling redness, or what is the downtime?
The downtime with the CO2 laser is it's a lot of redness, crusting, swelling, and because the skin is new and it's basically taking the top layer of the skin off in the CO2 procedure, it's a little bit of an infection risk, so you have to be really careful. We monitor you closely, and so it's a little bit of downtime with the CO2, but very, very manageable. That area heals very well.
Okay, great. If I get Botox every 3 months, after years, will the effects diminish?
Oh, actually, probably they'll be additive. So if you're pretty going to do it every 3 months, you'll notice that you might need less of the Botox over time. And then those effects in the brow position are cumulative. So you'll actually maintain that brow elevation for years. There's numerous studies that show that it does something for skin texture. So every time we have Botox, patients tell us they have this glow after, and so it's been studied that it's shown that the skin is a little bit more hydrated, maybe more elastic after repeated Botox treatment. So I think that's interesting, and that's still kind of being studied as well.
Okay. This is from Marty. Do you microneedle with PRP or inject it with a cannula below the eyes?
For usually, if patients want PRP, I will usually drip it after microneedling around the eye, just because it's like a little bit of safer and then a little bit more comfortable for patients. And then we do PRP a lot for hair loss too, and you can also microneedle the scalp and then inject the PRP that way as well.
Okay, great. Let's see. How long do the effects of the CO2 laser last? I think you kind of already addressed that one.
Oh yes, very long-term results, 5 to 10 years. So that's like a good investment procedure that will last for years.
Okay, this is similar to that. Do you really think that with Botox and fillers and lasers, I might be able to not have surgery or postpone the need for surgery?
I think probably postpone the need for surgery is one thing. It's hard to tell kind of the effects of gravity and time on the in the periorbital area, but a lot of times we're seeing it now. Patients are delaying the need for like a facelift because of this new technology and this lasers. And that's why, as you're seeing a lot of times in the celebrities, they're not having the facelifts anymore. They don't have the scars because of all this new technology available.
All right. Are there any preventative measures I can take to prevent my eyes and eyebrows from drooping besides eye creams moisturizing?
Probably one thing is like not rubbing excessively. So even when you're taking your contacts or something, just absentmindedly scratching the area, that is, each time you do that, it's like pulling on the skin and causing some skin laxity. And I didn't even realize this. Before like everything happened and not touching the face, that I was probably rubbing the eyes more than I should. And then of course having a good diet and sleep will help diminish the chance of wrinkling. And basically the goal is not to have inflammation in the area. Inflammation from a poor diet or medical conditions causes more aging and problems down the road.
That's great. Okay, this is from Cynthia. Does CO2 laser last longer than Fraxel?
It probably lasts longer than the Fraxel, like Restore and Dual lasers, which are the 1550, 1927 lasers. That will probably be a little bit longer effect than those non-ablative laser technologies. Though for young people, like around the eye, so for me, for my routine for around the eyes, I will do the non-ablative fractional lasers every 3 to 6 months, specifically around the eye area, especially lower eyelid, to tighten the skin. Just has less downtime, and you know, I don't have a lot of skin laxity yet, but it's just something as a preventative way to strengthen the dermis under the eye.
Okay, great. All right, guys, we only have time for a few more questions. So any final questions, please add them in. I see David and Srini are now discussing ophthalmologists in San Diego area. Do you have any ophthalmologists that you want to recommend for the eye floaters?
Yes.
You want to tell us who who you want to recommend? I think David is looking. But okay, let's see. One more question here. Are there any preventative? Oh, that was one we already answered. So let's see. What is a reasonable age to start treating the eye area?
So it probably will depend. If you have genetic hollowing or that genetic tear trough, I do see those patients when they're younger in their 30s because they start to just have these dark circles due to volume loss. So I'll see them in their 30s. But I would say probably in the 30s, just eye creams, maybe just very light Botox, maybe a clear and brilliant or Fraxel laser just to improve skin texture is all you need then. And then we add a little bit more lasers in the 40s and 50s. And then 60s and above, I probably will do like a more aggressive laser, like a CO2 laser that you just saw.
Okay, and here's the last one. So how do I know if the bags under my eyes can be treated with fillers or if I need a lower blepharoplasty?
Right, so that probably is, we'll usually, I'll evaluate in person, I'll evaluate the area, and then you can usually palpate to see if it's a fat herniation or swelling, and then I'll give you some recommendations for that. If it's repositioning of the fat, then I'll basically be like, this might need a surgery or blepharoplasty. If it's something we can do non-surgically, I'll let you know as well.
Okay. All right, great. Well, thank you so much for those of you that tuned in today. And thank you, Dr. Boen. That was amazingly helpful. I hope you all found it as educational and useful as we intend. I want to remind you all that we are available for virtual consultations right now. Dr. Boen is available and you can schedule them on our website, which is on the screen in front of you. We also have now moved into kind of phase 2 of our soft reopening. So we are available to see patients for some non-cosmetic needs, such as rosacea, acne, scarring, melasma, veins, Botox for migraines, TMJ. So please call our office. We are, of course, scheduling in the for future appointments. And we hope to open up for a lot more starting very soon. So please make sure you're following us on social media. Dr. Bowen's Instagram handle is right here. She'll keep you in the loop as well. And otherwise, we really hope you enjoyed this. You're going to get a little survey right when I shut this down. We'd appreciate any and all feedback you have, and also any ideas or suggestions for future topics. We want to make this as useful for you all as possible. Otherwise, thank you, Dr. Bowen.
Yes, thank you so much for taking the time to listen to the webinar, and hopefully we'll see you soon in the office, whenever that date is.
Thank you so much. You guys all enjoy the rest of your Thursday. Thank you. Bye.